Okay, my name is Jacob Gundy. I'm going to be doing a clean, no-touch, sterile changing of the dressing. So the first thing I'm going to do is I'm going to check my patient's records. I'm going to figure out who I'm dealing with and what I need to do. Once I know that information, I'm going to then gather my supplies, so gather them all, making sure the integrity is good, and also making sure that the dates are good as well. After that, I'm going to go to my patient's room, knock on the door, ask for entry. Once I get entry, I'm going to introduce myself as a student nurse from Madison College, and then I'm going to ID my patient with two markers, the full name and the date of birth, and check their wristband. So I'll do that. Got the wristband on. You are my patient. I'm then going to ask them about their pain, because I'm going to be describing the what I'm going to be doing, the steps, and I need to assess their pain. So on a scale of 1 to 10, 10 being the most excruciating pain you've ever been in, and 0 being no pain at all, how much you're in. And once they are okay with the pain level, then I will go ahead and change the dressing. So for that, I'm going to get set up. I'm going to raise the bed up a little bit. I like to work at my height. I'm going to lower this, get my supplies set up. Okay, so I'm going to do a little hand hygiene. And then providing for privacy, make sure we're all closed. All right. And then going to, providing for privacy still, want to loosen up and expose only the area that I'm working with. There we go. Okay. Get some gloves. Some clean gloves on. I'm then going to untie Montgomery straps. There we go. All right. Now, if I notice that the ABD pad is sticking, I would then provide some saline and see if it's not. So just to loosen it, I'm going to take the pad, doing it away from the patient's face so that they don't see it. Then I'm going to note the color, the mount, whether it's serous sanguinis, or sanguinis, and see if it's purulent or not. I'm then going to dispose of this in the trash. I'm then going to see if this is sticking, and if it were stuck, I would add some saline to it to loosen it. Once again, moving it away, and then noting the color, the size, the amount, and what type of exudate that it is, and then discarding this. I'm then going to take off my gloves and hygiene. All right. And then I'm going to do a local skin assessment of the wound right now, and I'm going to note that that there are 7 staples. I would measure it. I would note the peri-wound area. I would note that there is not a drain present, and note that my edges are well approximated. After I did that, I'm going to go ahead and set up my sterile field. Get my table up to working height. You're okay with this? Okay, thank you. I'm going to get all my supplies. And then garbage. I'm going to be touching just the outer edge of this. Drape, and blue bottom goes down. Sliding my supplies over. Good. I'm going to check my integrity of it. Looks good. Get the date. My ABD pad. Stay. Alright. Check my next one. Good. My gauze. Stay. There we go. Still within the 1-inch bounds. One more of these. There we go. I'm going to get some Q-tips out. These guys are tricky. Putting it away from my body. Okay. Garbage. Okay. Let's try this guy. These things are hard. Don't get on my sterile field. Garbage. Okay. I'm then going to, these are not necessary. I'm going to leave those there. Going to open up my sterile bowl. Open it up. Okay, garbage. check my saline solution. It's good. Looks good. I'm going to lip it. Garbage and pour. Okay. Don't need much. Then need to, not turning my back on the sterile field, grab some gloves. So I'm going to clean the wound. Okay. I'm then going to be working from the top down, clean to dirty. I'm going to clean the wound. I'm going to dip it, and then I'm just going to roll it once and go down. Then I'm going to discard. I'm going to grab another one. I'm going to dip it from the other side and roll it down. Discard. I'm going to grab another one, dip it, going from the outside and down until it is all clean. I am then going to pat it dry. So I'm going to take one of my gauze pads, and then I'm going to just gently wipe from top down, one and done. Take another one, go to the other side, make sure it's dry. Other one and done. All right, and garbage with that. I'm then going to take off my gloves, perform hand hygiene, and then I would need to provide a skin barrier cream around the peri-wound area. So then with that being said, I would get my wound barrier cream, apply it to my sterile field, and then I would need to put on more gloves. And then I would take my Q-tip, I would take the peri-wound ointment, take that, and then apply that around the peri-wound. One and done. And I would do that until that is all good. I would then, since I then did the assessment of it and it looks good, I would then need to take my gauze using the no-touch sterile technique. Just apply the gauze right down like that. Take one more gauze without touching what is going to touch the wound. Place that down. And then I'm going to take my ABD pad. Open that up. The blue line goes down, only touching the top. Gently place that on the wound. Okay. And then I'm going to, then I'm going to take off my gloves. Do that, do more hand hygiene. Make sure you have clean hands. And then I'm going to tie this back up nice and gently, not too tight, because I don't want to cause the patient any more pain than necessary, which is none at all. I would then grab a piece of tape and then write on the tape my initials, the date, the time of the dressing change, and then gently stick it to the ABD pad. So now I'm done with this. I'm going to move this. Now I'm going to continue with my, my skin assessment. I'm going to look around it. I already did the local one. I'm going to assess for color, see if there's any other lesions that I need to notice or look about. I'm then going to go above, check the abdomen. I'm going to check the skin turgor. I'm going to pinch, right, and see if that is good. I'm also going to look for any other kind of breakdown of the skin, any kind of lesions of SART, any kind of redness or swelling of anything out of the ordinary. I would assess the hair. If it looks like I needed to use gloves, I would wear gloves. I would go through the hair, look for any kind of bed bugs, lice, any kind of thing of that nature, see if there's any kind of redness or swelling. And then I would need to do an assessment of the nose and mouth. For that, I would put on some gloves. Just do this very quickly. I'll gently palpate the nose, make sure that if there's any tenderness. I would check if there's any mucus. I would then ask the patient to open their mouth. I would get my pen light and click in there and shine and look for the uvula and see if there's any kind of mucus, any type of swelling or anything like that. And I would check the gums and the teeth and make sure there's that. And I would also just notice if there's anything out of the ordinary. Then I would discard my gloves, because I'm done with that. More hand hygiene, do that. And then I would continue along with the assessment of the skin and the nails. I would look for the arms, just the arm on this one. I would look for edema. I would look for any kind of redness, especially where there's any bony prominences making contact with the bed. check for the edema, I would do the capillary refill. So I'd press on the nail, see if it comes back. For blanching, I would check just see if there's any clubbing. I would also maybe do a skin trigger here on the hand as well, and just check and see how clean they're. And then I would keep moving downward, providing for privacy. I'd need to assess the lower extremities as well. So then again, I would check for any kind of lesions, any kind of, and see if there's color, see if there's any kind of pallor, any kind of skin abnormalities. I would again check the nail bed, see if there's any kind of blanching with that. Looks good. The skin is nice and the color is uniform, and then looks good. Or then also to do, I need to check her back because she's on bed rest. So then I would ask her to help me roll herself over so I can assess her back. So I'd gently roll her over, and then I would check her back and just double check, see if there's any kind of bony prominences that are making contact with the bed. Look for any kind of signs of that. Check for any swelling or anything out of the ordinary, making sure that the skin is flesh colored and nice and not red and irritated or any kind of inflammation. And then I would definitely make sure my patient is ready to go. That would conclude my skin assessment. And then I would put the bed rail back up and put them back in the lowest possible position and document any of my findings for the patient. And make sure they have the call light. And then I would clean up and document, and that's it.